So why should bone health matter to everyone and not just the elderly?
Well, there are several reasons. First, everyone understands that bones are made of calcium, and calcium is making the bone stronger. Other minerals make the bone stronger. But not only that, bones also serve as the storage of minerals and calcium for the function of organs, the muscles, heart. Without calcium, the muscles wouldn't work, the heart wouldn't work. So if we have lack of calcium in the bloodstream and bones, it really affects every part of the body. When you look at puppies or children, often their diet is not really sufficient in calcium because they're not really eating species appropriate diet. When you think of puppies, often they get kibble. They don't get bones that they would normally chew, which leads to calcium deficiency and bone problems, bone density issues as well, but also bone development issues in humans and also dogs. So, when you look at minerals overall, and especially calcium, it is super important in the early age. Then in the middle age, it's important to replenish the bones because they constantly renew and rebuild. There are two types of bone cells. One of them is called osteoclast, and that actually takes the calcium away from the bone and dissolves it in the bloodstream. And then osteoblasts, which actually build the bone density again. And by the age of 50 for humans, we really start losing density. It's very clear that especially in women, but also in men, bone density is a huge issue because our diet is deficient, it's high in sugar. And when it comes to dogs, there may be some supplements that are in kibble, but generally a species inappropriate diet is really problematic for dogs.
Now, for the type of calcium to use in both human and dogs, what is the best source?
It took me many years to figure out what the best calcium source is. Obviously, the best source of calcium for dogs would be bones, but the bones come from animals that may be depleted in different minerals. So if you think of bones as a source of minerals and calcium, it really depends where the animals lived. So if you have regular livestock and bones from animals that are living on the farm or somewhere, fed inappropriate or lower grade food, it reflects in the bone health, and the bones may be actually deficient in some minerals, not necessarily calcium, but other minerals. So what I like to do is to ensure that we provide a full spectrum mineral source. And in the search, I discovered a little company in Vancouver, British Columbia, that actually imports algae-cal or Alga Calcareal, which is an algae that grows in Brazil. Has a long history in farming in Brazil, where they discovered that when they give this algae to horses and cows and livestock, that they grow healthier and much better and stronger. So that's how it all started. Then Algical, the company that we worked with, has confirmed that the bone density in women in a study has increased by 1% a year in a 7-year study. So that's huge because normally women, middle-aged and older women, should be actually losing bone density. It was pretty clear that I wanted to use the same source, plant-based source. The other reason why plant-based source is better, it actually is more bioavailable and digestible. You need to have very strong stomach acids for the traditional sources of calcium like dolomite and some others. And as we know, as we age, and our dogs age, we actually don't digest as well, and their stomach acids are not as strong. So again, plant-based calcium is much better, more available. And in addition, there are some other minerals that are super important in complementing calcium and bone building and organ building and all that. It's not just about the calcium. People always focus on calcium as the number one thing, but it is definitely not just that. The only other thing I wanted to say is, and people often ask me, so if I have a dog and I feed just bones, is it enough? And I would say it may or may not be enough. And because we really don't know where the animals that we source the bones from come from, it's actually always better to supplement with the full spectrum mineral. And I give my dog Pax bones, and I also give him plant-based mineral supplement, GreenMin.
And can you give too much of calcium in this instance?
Theoretically, you could give too much, but I don't think that anyone gives too much because number one, you know, any source of calcium is not free, and people just basically use the doses they're supposed to use. Theoretically, you could give too much, but I haven't seen any problems. We haven't seen any side effects. The 7-year-old study or 7-year study did not show any side effects of supplementing plant-based calcium. So the safety of the supplementation is super good.
And now you had also mentioned with women for the study. Is there a difference between women and men and osteoporosis? Is there a gender that is more predisposed to osteoporosis?
Yes. In dogs, actually, there is not as much of a issue with osteoporosis, but obviously bone deformities and hip dysplasia and knee issues and bone growth issues are more common. But dogs don't live long enough to actually start showing the signs of osteoporosis as often and frequently as in humans. In humans, females definitely have higher propensity to bone density issues. It is connected with menopause and estrogen decrease. But there's also some other issues, and when it comes to bone density, it's super important for people to exercise and do bone or weight bearing exercise that basically stimulates the bones. Because if we, let's say, sat on the chair for a year, our bone density will hugely decline. Even though we can correct it somehow with supplementation, exercise is super important. And here we are kind of getting in the realm of healthy dogs and healthy people. That if I have a dog guardian who can't move or doesn't move, eventually they end up with some sort of other issues, and the dogs will suffer. So we really promote the idea that healthy dogs have to live with healthy people. And this is one of the reasons why when I introduced GreenMin for dogs, after a while, many people actually started taking the dog supplement. And so after a few years, I decided to launch the human line because of the philosophy of healthy dogs need healthy people. It's something that I didn't really expect, but we worked with very experienced human supplement formulators just because I'm a vet. But I think that it really jives into the whole mission of creating health through knowledge and understanding and empowerment. And nutrition is definitely one of the important parts. I'm often terrified when I speak to my friends about nutrition, when I see them shopping for groceries, or when I see them actually not taking any support or any supplements, any omegas, minerals, or vitamins, anything, right? And then you hear them complain, and it's a very sensitive situation because I so care about them, and I would like to tell them what to do, just the simple basics, and it's just hard. So this is my struggle, and obviously with my friend who's ended up with triple lumbar fracture, it just breaks my heart because otherwise she's bright and happy and so on, and now I see her basically declining so much. It breaks my heart. That's one of the reasons why I decided to talk on this topic today.
You did mention about weight-bearing exercises. Are there anything that you shouldn't do aside from not moving?
Jumping off the cliffs. Just kidding. Well, it's actually high impact exercise is fairly good. So let's say running is good, or hiking, or hopping on rocks and roots and so on, and balancing as well. Sometimes you can definitely swimming would probably not increase the bone density as much as the weight bearing exercise.
So it is that like
cycling,
impact.
exactly. So
Right.
the impact is really important, and sometimes. If you think of the impact, we actually wear cushioned shoes and so on. Like it's actually better if we wear minimal shoes and if we have that impact, if the bone carry it. Touch wood, I have not had any knee issues or hip issues. And I do think that it's partially because I wear minimal shoes. My favorite brand of this is not sponsored advertising, but my favorite brand is Vivo Barefoot. Vivo Barefoot is an amazing company, quality product, and I don't have Vivos here, but yeah, it's a really good company. Or the 5-finger shoes, the toed shoes that everyone
The
laughs about.
toes.
They're fantastic. I've been hiking in them for the last 20 plus years. Just like I wouldn't go back. It's so awesome. It also massages your bones, right? And you see so many people breaking their bones, and people like this is what happens, right? Like when we start losing stability and core strength and bone density, then it leads to fractures. And unfortunately, in humans, immobility is one of the primary causes of decline, beside metabolic disease like diabetes and heart disease and so on. So super important for people to get off the couch. I can tell you today, like I was so close not to do any exercise, and then I did half an hour before we started because I knew I had to, right? Like I'm going to be celebrating 60 in a month, which is very scary, but it's also encouraging that I didn't expect to be as mobile as I am now. Not to say that I don't have issues. Like sometimes I put my back out, or I don't want anyone to get an impression that I'm this perfect being that doesn't have any health issues. But it's just it's super important to do as much as we can and learn from people who know more, which I love to do as well.
And with, obviously, you take GreenMin yourself, but what other supplements complement GreenMin that you would recommend to your friends and family if they were asking?
Yeah, it's people often ask me, so if you take just one, which one would you take? And it drives me crazy because it's like saying, so which one is more important, the steering wheel or the wheel of a car, right?
True.
Like you can't really make a decision like that. So I'll tell you what I take, and I try to simplify things so people don't really get overwhelmed with going in the store and seeing like hundreds of different supplements. So
Yeah.
I basically recommend starting with the essentials, and we call them Fabulous Four because there's four of them, and that's GreenMin, which is the plant-based mineral support, then omega oils, and again, when it comes to sourcing of omegas and so on, it's very complicated. A lot of the sources are not sustainable, or they're toxic, or full of mercury, so it's really challenging as well. We make one in Norway. Omegas are super important, especially in aging, for anyone. Again, babies need it for brain development. Teenagers need it not to be stupid. I shouldn't have said that, maybe, but especially for middle-aged and senior people, memory loss and blood protection of the blood-brain barrier is super important. And when you look at omegas, they actually really protect our brain from toxicity. And sometimes it's just enough to take a few capsules, 2 grams of omegas a day. People take not enough usually. They take 500 milligrams or 1,000 milligrams. That's not enough. They have to go at least 2,000 milligrams or even higher. If they have any issues, cognition, dementia, Alzheimer's, Parkinson's, they really have to actually take more. And to prevent these diseases, again, don't hesitate. You can't overdose yourself on those. Then vitamins. And vitamins are tricky because people just go to the grocery store and they think vitamins are vitamins and that's it. But many of them are made of coal or crude oil. As far as I know, we can't really make food from crude oil and coal. So how can someone make vitamins, and pretending that they're the same? They may be similar. They're like the plastic apples in the bowl in the store, but they're not the same. So the other issue in vitamin production is that we can't really take, let's say, 100 pounds of oranges or lemons and make vitamin C. It would be super, super, super costly. So we've involved a fermentation technology that basically incorporates the vitamin and the bioprotein, and it actually is much closer to the regular vitamins, have greater efficacy, better absorption. It's like pre-digested food basically for the body. And especially as we age, our digestion is not as efficient. So this is really, really awesome. And the other trend that I've noticed is that many of these fermented human vitamin companies have been acquired by big conglomerates and big companies. I'm looking at the labels and now I'm seeing that the fermentation doesn't happen to all the ingredients and only to some because it's cheaper. And suddenly you have all the shareholders and companies that don't care as much about the quality of the product, but more about the profit. So I'm not really sure whether this is a smart thing, but one of the things that I've done is that we have zero shareholders. We have nobody to answer to when it comes to the quality of our products and how we spend money. And it really has benefited the final product, even though it's more difficult and challenging. Obviously, we are not the greatest, the largest company in the world, but we really try to stay with the fermentation because it's made so much difference. And one of the reasons why we see so many good reviews and such good feedback is that the fermentation really multiplies the effect of all these ingredients. Plus, what I did with soul food vitamins for dogs and soul food H plus for humans, we added some organ protective ingredients like turmeric and asparagus and apple cider vinegar and all these different ingredients that actually enhance not only absorption but also support some of the internal organs. Nobody would expect to build a bike without the parts, right?
Totally.
And nobody would actually expect tomatoes to grow without really the proper organic fertilizers or whatever.
Absolutely.
We recognize when there's a plant that is depleted, house plant, right? Like, all wilted and yellow. Like, we know something is wrong. And at the same time, we just kind of totally forget. We think that our body is some sort of perpetual mobile that doesn't really need anything. Yeah. So the last fabulous four is Gutsins. Gutsins is a probiotic formula, digestive formula. It doesn't have only probiotics, but it also has prebiotics and some other digestive support in them. When we came up with Gutsins and we started seeing the positive changes, I kind of thought everyone is happy about perfect number 2. Like, how can we not be happy about perfect number 2, right? Every dog lover goes with their baggie and first checks, and if it's nice and formed and perfect and doesn't smell too much, amazing. And that's what our goal is, basically. And there are a lot of dogs with inflammatory bowel disease, and there are so many dogs with leaky gut, diarrhea, chronic diarrhea, and so on. I have extensive articles on the website on how to deal with diarrhea, because it's not just about probiotics, but there are also some other components to that. Like, many people don't know that dogs who have chronic diarrhea often have misalignment in the lumbar spine, for example. But probiotics are not only good for digestion, they're important for maintaining the gut-blood barrier as well, to prevent leaky gut and prevent leakage of toxins and free bacteria in the body. They're good for the immune system. 80% of the immune system lives in the digestive tract. So it's super important for immunity. And I remember when I was growing up, every time around Christmas, when I would gorge on Christmas cookies that my mother made, I would end up with some sort of cold, right? And we know that when we eat sweets and when we're not really eating exactly well, our immune system gets weakened. And when it comes to human Gutsins, we launched it last year. It was our second last product that we launched. We are launching a mobility product in a few weeks. Human Gutsins H Plus has really surprised me. I've had a few friends, I'm not going to name, obviously, who confided that finally they're regular after all those years. And so that's actually really nice to know as well, that it helps with constipation and irregular bowel movements. And the gut is just important. And, you just have to go with your Gutsins, right?
Agreed. So going back to now GreenMin and the calcium aspect of making sure that your bone density stays to the best of its capability, if you will, are there any medications that can impact bone density?
When it comes to meds, I don't have love and hate with one drug. I have hate with one drug, and that's corticosteroids, because I've seen them causing so much damage. They basically put the immune system to sleep. They make the body respond erratically to any kind of disease. It's very hard to treat any patient after steroids, especially long-term steroids. And I see steroids being used so often from allergic reactions to shoulder pain to whatever else. And people don't realize that when they suppress this inflammatory response, especially early on, that they actually stop the healing. And they also affect the adrenal glands and the pituitary gland and all that. So it's super important for people to avoid corticosteroids. I'm a big swimmer, and recently just about 6 months ago, I started having some shoulder pain and ended up with frozen shoulder. But I was determined just to do exercises and not to use any anti-inflammatory drugs because I knew that the body basically will eventually heal if I don't interfere and if I strengthen and promote blood circulation in my shoulders. So I started swimming again, very proud, no steroids. But going back to bone density, yes, corticosteroids actually affect bone density for sure.
And for early diagnosis of bone density loss, there's a DEXA scan that you can do. Can you explain what that is? And
Yeah, so DEXA scan is basically a very low level radiation scan that assesses the bone health and bone density. Every female over 50 should have a DEXA scan just to basically see where they're at. The kind of like a gray zone where we would call the condition osteopenia or thinner bones would be from -1 to -2.5, and it's compared with normal bone density basically. And everyone lower than -2.5 is actually has gets a diagnosis of osteoporosis. If there are any males that have history or genetic predisposition to bone density issues, super important if they have fractures. All females should get bone density scan, DEXA scan by the age of 50. Again, like supplementing, and this is the most beautiful part, that supplementing plant-based calcium actually can increase the bone density based on the research by 1% a year. And this should be declining, right? Because people get older and they've been increasing. In 7 years, they've gained 7% in this study,
which is incredible.
Yeah, it's really amazing, and I'm so grateful that we have Alga Calcareal and GreenMin.
What is the difference between osteopenia and osteoporosis?
Osteopenia is basically just bone thinning, so it's not as dense as it should be, but it is not as thin as osteoporosis. And again, there are two types of cells. The osteoclasts actually take the bone apart, and that's a normal process throughout our life. And we are able to, until about the age of 25, we gain bone density. And then from 25 to 50, we're able to maintain it. And after 50, we start losing it, especially if we are inactive or menopause plays a role, as I said as well. So osteoclasts take the calcium out of the bone, and in the bloodstream, osteoblasts actually bring it back in the bone and build it up. And the osteoblasts they just don't function as well, and they don't build the bone as well. And there's number of different reasons. One of the things that I think is important as well is to really start transferring and transitioning in veterinary medicine to ovary and testicle sparing sterilization. Because, again, absence of these hormones can lead to bone deformities, bone growth issues, and sometimes osteopenia and osteoporosis, but not as common in dogs as in humans, for sure.
And actually, touching on the hormone replacement, for humans, can you do postmenopause?
Yeah, there are some people who have been doing, I'm not a human doctor, but the site of reference that I would recommend is Dr. Peter Attia. He's had very extensive materials on hormone replacement. Some people worry about the increased propensity of cancer, but I think that there are some now. There's some research that suggests that if you give the right doses, that the risk is not there, but the benefits are there. In those situations, I would recommend talking to an experienced doctor, not just a doctor, an experienced doctor, because what I noticed in medicine in general, whether it's veterinary medicine or human medicine, we doctors often don't like to say we don't know. And I don't think that it's all our fault, because at school, if we said we don't know, we would fail. And that kind of like neural pathways has been ingrained, right? So I think that talk to a doctor who says, I don't know, at least about something, right? I would be always careful and cautious, especially when I know some of the pieces of information and I see a doctor is making things up or says, I would say, so is there a possible side effect of this? And they would say, absolutely not. I say, well, how about, let's say, with steroids? Like, how about, lack of healing and potential to infections and so on. So you really have to empower yourself. And this is not to discount the amazing work that the whole profession does, and it's very hard work. But I think that it's super important for us to be empowered and being able to sort things out, the information out, because otherwise we're at the mercy of someone who is just human, right? And they may have not paid attention in school to everything. And to be fair, there's also such overwhelming amount of information that many clients are greater expert in some topic if they're, let's say, if their dog has a, has a condition, right? And they've gone online and they've read every single study and everything. So don't expect your vet or your doctor to always know everything. Expect them to understand the body functions and metabolism and drug interactions and the consequences of certain treatments, and being able to deduct easily, right? Like I have this ability to develop this ability to just kind of see the pieces all together and say, okay, I should be careful about this drug, or I should be careful about this because I know that there may be a side effect, and then just kind of combine it together. And so it's a lot of fun, but it's also challenging. Definitely, challenges are, well, it should challenge our ego, because ego is not very good in medicine. I think that we have to be confident, but not really self-centered and egocentrical. That's for sure.
Is there one piece of advice you would give to the younger generation to prioritize their bone health early on?
Get off your ass. Exercise. Don't eat sweets. Eat healthy diet. Vegetables have a lot of calcium as well. Supplement your diet. You're growing. You're building your body for the future. We have visitors right now, and they have 3 kids, 18, 20, and 20 plus. When I see their grocery cart, I would cry. At the same time, I know I can't do anything, right? But then those are the people who kind of can't move, right? They start with knees, they're in the 30s and 40s, and they just, they arch, they slump, they start having back problems. And younger generation, I love younger generation, especially Gen Z, because they've kind of faced the reality a little more, so they're really nice to talk to. So, but anyway, let's see what they bring us.
Is there anything else that you wanted to add?
You're more complex than a bike or tomatoes. Just make sure that you get all the nutrients that your body needs. You'll see the difference. You'll never go back. That's all.